Hello everyone, I am Hossam Hassan. Thanks for giving me this opportunity to present my work in the third IEEE Middle East and North Africa Communication Conference. I would like to thank my co-authors, Abeer Thamara, Professor Mohamed Elsersy, Dr. Ahmed Sherif, Omar Abdelsalam, and Dr. Khaled Almorairi. Also, I would like to give my sincere appreciation to the reviewers of the paper for their insightful comments that helped me to improve the quality of the work. I will be presenting a novel classification of machine learning applications in healthcare. I will begin with the motivation towards machine learning in medical science and the healthcare system, and I will give a brief introduction of different machine learning techniques that have been used in the healthcare application nowadays. Then I will go through the approaches we use to classify the machine learning algorithms used in healthcare applications, as well as the contributions of researchers in this domain. As we all know, machine learning has become widely used in various applications and research, as it plays a crucial role in numerous fields, such as medical science and the healthcare system. Moreover, it is used to diagnose sizable medical data pattern or predict diseases. This motivates us to make a survey about different machine learning algorithms with their applications in various domains and show the advantages of machine learning techniques that help create efficient support infrastructure for medical fields and improve healthcare services. The main objective of this work is to highlight the previous work of machine learning algorithms implemented in the healthcare system and provide all necessary information to the researchers who want to explore machine learning in the healthcare system. The life expectancy has decreased due to the COVID-19 pandemic from 90 years to lower than 60 years. Humanity lost around 20 million in average due to the COVID-19 pandemic. The pandemic spread all over the world. The spread of the COVID-19 motivates us to focus our work on the practical applications of machine learning in healthcare. As shown in figure, artificial intelligence and machine learning are widely used to solve many challenging problems and tasks in our life. AI is a technique that allows machine learning to behave and imitate human acts through repeating their behavior and nature. Machine learning is considered a subset of AI techniques that can auto-learn based on the algorithms to make predictive analytics than humans. Neural networks are linked nodes named artificial neurons that models the neurons in biological brain. Deep learning is a neural network containing three or more hidden layers. It learns from its faults, so it doesn't need human intervention. As shown in the classification, machine learning techniques can be divided into four categories: supervised, unsupervised, semi-supervised, and reinforcement learning. Supervised learning involves a method that maps the input to the output using data containing a label. An efficient model can be created by training on the data and then using that model to predict output without relying on any other information. It utilizes the artificial neural networks and support vector machine algorithms. It is used for classification and regression. Unsupervised learning can deal with unlabeled training data and then search for hidden pattern and information in the unlabeled data. The unsupervised learning uses the k-means clustering and principality component analysis algorithms. It is used for many tasks such as grouping, clustering, or dimensionality reduction. Semi-supervised learning is a combination of supervised and unsupervised machine learning techniques. Reinforcement learning is an area of machine learning concerned with how intelligent agents ought to take actions in an environment to maximize the notion of cumulative reward. Reinforcement learning uses quality learning and deep Q network algorithms. Machine learning currently used everywhere around us. For example, in online applications, autonomous vehicles, smart grids, cell phones, and medical systems. As shown in figure, we focus our using of machine learning in healthcare systems. The medical data is increasing, hence the dataset classification and predicting correct disease are critical. By using machine learning, the processing of large datasets becomes easy. There are many uses of machine learning, such as intelligent healthcare and medical imaging analysis, besides the diseases prediction for various life-threatening diseases. Drug discovery and manufacturing also use the machine learning. Our classification of machine learning in healthcare applications is divided into four categories: chronic disease diagnosis, non-chronic disease diagnosis, drug interactions and drug side effects, and other health care applications. The chronic diseases and non-chronic diseases diagnosis cover different types of diseases. Chronic diseases are generally known as the cases that need continuous medical attention or limitation of daily life activities, or both. Chronic diseases such as heart diseases, cancer, and diabetes are considered the leading causes of death. This classification lists the recent research papers on the existing machine learning techniques for diagnosing and predicting chronic diseases. Diabetes is considered one of the dangerous diseases that has caused several deaths in the world. Paper 3 suggested decision support system for diabetes prediction using machine learning techniques and comparing conventional machine learning with deep learning approaches. Paper 4 used 6 different machine learning algorithms to predict diabetes disease. Paper 5 proposed an accurate and effective framework to identify type 2 diabetes from electronic health records. Epilepsy is a severe neurological disease that may cause sudden unexpected death. However, if seizures are controlled and medical support is given when outbreaks occur, the probability of mortality will be decreased. Paper 6 explored a method for classifying epileptic seizures for patients through using supervised machine learning and deep learning models. Paper 7 and 8 targeted towards heart diseases. Respiratory problems and cancer diseases are considered among the top killing diseases. Paper 9 proposed respiratory disease detection by identifying voice changes over time using the deep learning algorithm. Paper 10 proposed an efficient method to accurately discover lung cancer and its phase using support vector machine and image processing techniques. Paper 11 presented a model called clustering-based feature selection that can predict breast cancer diseases using machine learning classifiers. Chronic kidney diseases (CKD) is one of the most critical diseases people face worldwide. CKD is caused by damage to the kidney and its inability to filter blood in the way required. Paper 12 proposed a new model to diagnose and predict CKD using reinforcement learning and neural network algorithms. In paper 13, the authors developed a model based on machine learning technique and identified blood biomarkers of early Alzheimer's diseases detection without dependence on amyloid proteins. For non-chronic diseases, as we all know that COVID-19 has affected the world overall and caused millions of deaths. Many researchers are concerned about this. In paper 14, it analyzed the pattern of COVID-19 transmission in India using algorithms such as polynomial regression and supported vector machine. Paper 15 proposed a deep learning model using 3D CT volumes that predict the probability of contiguous COVID-19. In paper 16, it used the deep learning approach to enhance predicting unknown protein sequences, where centralization sites also used the support vector machine to select the notable features. In paper 17, refers, it refers to the increased stress among employees because of changing lifestyles and work cultures. Also, paper 18 proposed using a 90-second scare induction task to measure the participants' movement using a wearable sensor to diagnose anxiety and depression among young children. In paper 19, the authors presented a general disease prediction model based on patient symptoms. Paper 20, based on a smartphone and KNN classifier, the authors presented a practical application of cough detection. It is easily noticeable how machine learning is utilized to accurately predict diseases in the extensive medical data and healthcare system, hence playing a critical role in early patient treatment. Besides using the machine learning techniques for disease prediction, it is also used to discover drug interactions and predict drug side effects. This table lists the recent research papers on the existing machine learning techniques for drug interactions and drug side effects. For other healthcare applications, the chatbot is considered a way that allows users to understand the indications they are meeting and obtain primary diagnosis about the diseases they could be holding. The bot may present an accurate diagnosis or not. In paper 25, the chatbot gave better results using machine learning and AI techniques. However, in paper 26, it presents a health assistant bot that is based on Telegram conversational operator. In paper 27, the authors proposed real-time clinical decision support system based on unsupervised learning. In paper 28, it used a mimic learning approach that can transfer private patient data to a shareable model without sharing the original patient data. On the other hand, based on CNN, the authors of paper 29 deployed an machine learning model that accurately defines compounds that effectively deactivate vascular networks from images picked before and after drug usage. At conclusion of our presentation, there were no technologies or tools available in the past, and it was challenging for healthcare professionals to gather and analyze the massive data for efficient predictions and treatments. Now, with machine learning, the processing and classification of large data sets has become easy. This study presents how machine learning plays a significant role in our lives, especially in the healthcare system. Based on the machine learning algorithms, we can early diagnose and predict disease and discover the relationship between drugs and diseases. Our novel classification summarizes the existing work on machine learning usage for healthcare for different diseases. Moreover, it is also profitable to provide data in real time to the healthcare team so they respond fastly. Last but not least, thank you for listening to my presentation. If you have any questions, please contact me at the provided email. Have a great day. Thank you.